Hello, everyone. Thank you so much for helping out another session. If you don't know me, my name is Ransom Onyema. I'm a radiography fourth year student based in Nigeria, and also a medical writer and also YouTube content creator. And if you're a returning subscriber, thank you so much for coming on. So today I have an amazing guest speaker all the way from the US. Hey, could you introduce yourself to the audience?
Yeah, hi, I'm Ariella Tal. I just graduated from my undergraduate degree in biology, and I'm about to begin my master's at UNC-Chapel Hill. I'm getting a master's of public health, and I currently work as a fellow for FemHealth Insights. So I'm very involved in the femtech space and really passionate about gender health equity and women's health. And I'm really excited to be here. Thank you for having me.
Amazing. Thank you so much for talking us through about your journey and yourself a little bit more. And I know that the audience, know you a little bit more now. So the first we have a lot of questions for you. Are you ready?
Yes.
Now, the first question goes this way. Can you share what inspired you to pursue your Masters of Public Health at University of North Carolina, Gillens, right? And
Yeah.
f- you, and your focus on gender justice. Talk us through.
Yeah. So basically, I was matched with an internship with a startup called Noga Fem, and they are in the femtech space. And it kind of opened my world to health equity and health inequities that exist. And throughout the rest of my time in my undergrad, I just really started to absorb more information and become really passionate about bridging the gaps and improving gender health equity. And so basically I was trying to figure out what am I going to do when I graduate, and I went to the career center and they kind of guided me and said have you considered a master's of public health. And UNC Gillings has the number one public health program in the country. And so I knew that that would mean there would be a lot of resources, a lot of opportunities. The faculty there is extremely kind and amazing. And so everything kind of worked out for me to be able to go. But yeah, I was really driven by this passion for health equity. I knew I would get the tools and the information I needed to continue in my career and be able to be a part of creating more gender health equity.
That's amazing. You stated that you studied biology in undergrad, right?
Yes.
Okay, so what made you to decide to move into biology? Because I know a lot of people that they did biology and they just want to go into med school to, because they wanted to go into med school. But in US, you don't just go into med school. You have to do some other courses before you move into med school. So why didn't you, go into med school, and why did you choose biology? Tell me.
Yeah. So I originally went in and I was a pre-nursing student and I was very passionate about health and interested in that. And then the more I went through, I realized I really loved biology. And I loved the classes that I took and the professors that I had, and just became really interested in it. And so I ended up making the switch halfway through college. And yeah, I just loved it. I found it really interesting and I just wanted to study something that I genuinely was interested in. Um, I just never wanted to go to med school. I think it is, and I'm sure you know, it's a calling to want to be a doctor. And I never had that. And I kind of had this thought of um, if I can contribute to public health, I can kind of fix the healthcare system. You can be one person and make a difference. You know, you can be a doctor and be passionate about health equity. But I kind of wanted to be more than a nurse or a doctor or a PA. I wanted to be able to be involved with the system itself and create change within that system. And so I kind of want to use my biology background and my scientific understanding to go and make changes within public health and, you know, in femtech and in women's health, kind of approaching it from a strong scientific background, but creating changes that will, you know, create a better world.
It's amazing to hear from you that you determined your calling before time, which is an amazing. amazing stuff. And it's not everybody that is called to be a doctor. You can be a doctor and also have other interests. Because I know a doctor that after practicing for 10 years, he had to just drop it, moved into you know entrepreneurship full time. He's now an entrepreneur doing a lot of things, and it's really amazing, and I'm really proud of you, and wishing you the best and success in your master's program.
Thank
So
you.
the next question for you is, how do you think the femtech space will evolve over the next 5 to 10 years, especially in terms of women's health? Talk us through.
Yeah. I think that the femtech space is more and more going to be based in data. And I think on always either data security, we're seeing some problems with current data security with menstrual tracking apps. I think that's going to be improved. But I also think just gathering data, that's something that FemHealth Insights focuses on. We have the world's largest database tracking femtech companies. And that's really important in the industry of being able to kind of prove that it's a credible industry and there are people that care and people that are investing. So I think having that information, but in turn, I also think data personally, having women's health, having their own data like Aura Ring and other wearable trackers that are focused specifically on women's health needs. I see that being the future and people really understanding their own health, being able to go to their providers and saying, I know this information about myself, I'm tracking this information, and being able to notice changes or being able to notice just really arming themselves with information about their own health. I see that being the future of women's health.
Thank you so much for talking us through about that. So I want to get you straight, all right? When you talk about women's health, are you talking about the generality about the health of women, or do you have some specifics in terms of the women's health?
Yeah. So it's a mix of both. It's everything. So the definition that I've heard that I really like is basically that diseases impact women differently, disproportionately, and exclusively. So exclusively could be something like endometriosis, that if you have you have to have a uterus to be able to be impacted by that disease, as far as I understand. So there are certain diseases that specifically impact women, but something like heart disease impacts women completely differently than men. And so it is inclusive of all different diseases. Also, it is inclusive of people who are biologically female but maybe don't identify as a woman or trans women. I think that definition is also included. But right now, I think where the movement is at, women's health is just a more digestible term for people to use, and maybe there's a future where there is a more inclusive term. I hope that there is. But yeah, it is all diseases, all things that impact either women or those that are biologically female.
Hmm. hmm. Amazing, amazing. Thank you so much for talking us through about that. It's amazing, that you are offering a narrative on those questions, because that question was very intriguing, because you're talking about the future, 5 to 10 years from now, and it's amazing that you're planning yourself before time, which is an amazing stuff. It talks about making the hair while the sun shines, because if you're laying your foundation properly, it's the foundation determines the standards of the building. If you have not a solid foundation, the house will definitely fall. But if the foundation is really very strong, there's no moment that the building will start shaking, or because of the foundation. So I love the fact you're building your foundation because of the future, which is an amazing stuff. That drives me to the next question for you. What are the biggest challenges in promoting gender equality today? Because I know beforehand that there are a lot of challenges, a lot of things, restraints, in terms of promoting gender equality today. When you talk about racism, you talk about other things. So tell me, what are the biggest challenges right now in terms of promoting gender equality, Dr. Steele?
Yeah, I think, yeah, there are so many barriers. And I think there is a huge educational barrier where a lot of times there's just a lot of explaining that has to be done. Especially, I know in the femtech space, we talk a lot about how depending on your audience, the first part of a pitch could be just education on why something is necessary, why something is important. And so I think this education gap, a lack of information, and I think that leads to, most people don't believe, women don't deserve equal health and going through race that, I think a general sense people believe in equality and they think that they do, but when they're missing information, they're not able to uplift and create equality in a lot of ways. And so I think this lack of understanding that this is a problem, and why it's a problem and how it's impacting people, that is a huge barrier, because then you have to explain, no, this is a problem, this is why, this is how it's hurting people, and it takes time and it takes conversation and it's uncomfortable, it challenges people's current beliefs, and it is a barrier. But yeah, I do think it's not because people have bad intentions that there are barriers. It can be ignorance and just a lack of information.
I think we had a little glitch in the network, um, but that's fine.
Fine.
Um, so yeah, do you think that social media is one of the challenges in terms of promoting gender equality today? Do you think?
Yeah, I think that social media can be a really good tool and can spread a lot of information. But at the same time, there is a lot of censorship that's happening on social media. And I think that does definitely put barriers. It puts barriers in people being able to promote their companies and promote all kinds of education, and it's based off of certain standards of, like, saying the word vagina that can be censored a lot of times. But if there's a product for it that's targeted at someone that's female, they have vaginas, and so, like, that's not a dirty word, that's not a bad word, but because of an algorithm, because of how media is set up, it can censor those words. So yeah, that is a huge barrier that can prevent people from getting educated and prevent people from having access to information.
Wow, I believe that there are other people that are really working, in the same, alignment with the kind of work you offer to the team. So I need you guys to, make use of social medias out there, because I'm talking to gender educators out there who are going to watch this video. Make use of the social media, because social media has advantages and also has a disadvantage, a whole lot of disadvantages. So just try your best to make it, a better place for us, to learn one or two things. So thank you so much for talking to us through about the biggest challenges right now, in terms of promoting gender equality today. And that brings me back to the next question for you. So, could you tell us about the new projects, and researchers you are involved into improving women's health? Talk us through.
Yeah, I so through FemHealth Insights, they have so many projects going on. One of the biggest ones is that Dr. Brittany Barreto is publishing her first book, and so I've been very involved throughout that process. And the book is a huge opportunity to get the femtech world and kind of recognized in a bigger audience. And so that's been a really exciting project that I've been involved in. And then also currently, I'm beginning my own landscape report on the maternal health femtech space. And so that'll be out in a few months, but I'm currently working on kind of generating data on, well, we have the data, but using the data from the FemHealth Insights database to basically find what are the trends within maternal health femtech startups. So I'm really excited about that because that will be my concentration for my master's, and kind of, help me set me up very well, but also give people access to what does that landscape look like. So I'm really excited about that.
Yeah, that's next month. You're starting the masters. Amazing. Just a few days from now. Which is amazing for you. And I just wish you the best because masters in public health is really not an easy thing to do, an easy course to do. Because I've had a lot of people that did public health, they graduate and also did masters in there, and also that same course in public health. And there are a lot of challenges they talked about, but I know that you're prepared for it because you're already, you're planning forward, like you're planning for today and also planning for tomorrow and the next tomorrow. So which is amazing stuff. So thank you so much for talking us through about the new projects and researches, you're involved or you're yet to get involved in terms of improving the women's health, which is amazing stuff. And so do you, do you think partnership can be part of your new projects and researches in terms of improving women's health?
Yeah,
Are you
I
ho-
think
are you longing for partnerships?
Yeah, I am always looking for people's perspectives. I think that's the public health space. One of the things that I love about it and why I was drawn to it is it's people from completely different backgrounds, but their common interest is that they want to improve public health in some capacity. And so I think partnerships from people who have any kind of perspective add so much value and kind of this interdisciplinary work and perspectives and conversations. I think that's key to creating solutions. And so, yeah, I'm always looking for someone else's perspective and someone else's, their different background, what they can bring and what information they can bring and teach me.
Okay, which is amazing stuff. And like it's amazing that you're looking for partnerships, which is amazing stuff. So kind of like, have you like volunteered in any organization currently in terms of your work?
Yeah, so I've done a little bit of volunteer work with Planned Parenthood. It's been, politically, Planned Parenthood is like not the most well received, and so I've been working with them on just kind of getting memberships and getting their information out there. And the election is coming up, so Planned Parenthood takes a huge part in campaigning and really having conversations with people. And so I've been a little bit involved with that. But mostly right now, my time has been with FemHealth Insights and devoting a lot of time to my work with them, which has been amazing.
And people really undermine the work of volunteering. Volunteering is like a stepping stone to what you're looking for. If you're right to like me, you have to do some volunteer works. To up your game. And it doesn't only signify about like upping your game. It's like exposure, gathering more exposure. Because experiences is really very important in everything we do. So yeah, thank you so much for sharing that with us. About your you know partnerships and your projects and your researches. To improving with the focus on improving the women's health, which is amazing stuff. So the next question for you is, what role do you think you can play in closing the gap in women's health or women's health care, especially in underserved communities out there? Talk us through.
Yeah, something that I've mentioned and I'm really passionate about is education. And so I hope to one day be a part of educating populations and educating, future healthcare professionals on underserved populations on their specific needs. And that's also something with public health that I'm really excited to be involved in. That is central of people who really need the help. How can we get them the help that they need and tailoring it to their specific needs? Because often there's a lot of times that even in femtech, a solution might come up, but it's not applicable to everyone. It might be only applicable to people in America, but it doesn't have a global perspective. And so at Gillings, the program that I'll be attending, it does have that global health perspective, and I hope to be able to really learn from that and be able to apply that in my future career.
Amazing, 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 amazing. Um, you know, it's good to attend events, virtually or in person events. It's an addition. So talk us through about that event. Tell us more about that event. What does the event talks about? Is it majorly about women's healthcare or is it diversity in the healthcare?
Yeah, I've been to a lot of events that really it's always intersectional is how I view it. And there's no women's health without talking about all women of all sexual orientations, of all races, of all socioeconomic backgrounds. I think it's completely intersectional. And that's something that I'm always fighting for. And that's something that a lot of the events end up discussing, whether if it's specifically about women's health or it's about racial health equity. It always comes hand in hand, and the solutions oftentimes bring together. That's why it's important to bring together multiple perspectives, because those solutions are interdisciplinary and apply to multiple different people. And creating health equity is for everyone and looks different, and the solutions look different. But yeah, it brings in all different backgrounds and all different perspectives.
Amazing. That's amazing. Really very amazing. So we have the last question for you, Tal. So you ready?
Yes.
Okay. It's a bit very tricky, but you sounded very ready for it. So I get very ready. So the last question for you is what advice would you give to other students or professionals who are passionate about, promoting gender equality and working in the women's sector, in terms of technology? What advice do you have for them?
Yeah, I so something that Dr. Brittany Barreto said once was we do like weekly or monthly seminars, and she kind of gives us educates everyone that works on the team about the women's health space and everything like that, what's going on in the industry. And something that she said was you really have to be obsessed with it, and really, it could be, she wears like uterus earrings to conferences, and and people know that she really cares, that it is like her life. And I think that's kind of my perspective on it too. Of For me, it was listening to podcasts. And I listen to Femtech Focus, that podcast, all the time to learn about the femtech space and learn about women's health inequities. It could be reading books. There's so many books out there. And really, I think it's arming yourself with information while you can until you find the opportunity that suits you and find what you're really passionate about to be able to contribute. I also have kind of incorporated it into like other aspects of my life with school projects. I got involved in the Entrepreneurship Center my last semester, and I brought in women's health and health equity into that project there. Or if I've worked on papers, I've brought in some aspect of that to really develop my learning and develop my understanding, and also in turn educate people that I'm working with or presenting to on the things that I care about. And so I think really just kind of taking it on and having passion for it will kind of show and be able to guide you a lot.
Wow. You've been an amazing guest speaker, Tal. And I believe that the audience, will really find this video very insightful. We've come to the end of the session. So before we wrap up the session, what are your last words for the audience?
Yeah. One, just buy Dr. Brittany Barreto's book when it comes out. I've helped a lot, and she's worked really hard on it. And also just that health equity design, that you're allowed to design the future that you want. And health equity is part of the future that I want and I believe in. And so I'm working every day to get one step closer. And I think that everyone can find that passion in their life and find that purpose in their life to be able to bring them closer and bring the world closer to a future that we really believe in.
That was an amazing nugget right there. So if you love this content, do well to, like, subscribe, and share to your network, and hopefully someone in your network will really, really adore this video. Thank you so much, Toe. Thank you, everyone.
Thank you.